Hi, I'm Mark Kennedy, Clinic Director at Winchester Sports and Spine. We are a multidisciplinary clinic here in the heart of Winchester, specialising in the treatment of back pain, neck pain and sports injuries. Today I want to talk to you about sciatica. Sciatica is a condition which many people suffer from, relating to the nerves that supply the muscles and the sensation in your leg, particularly down the back of your leg, down the side of your leg and into your lower leg. Some people with sciatica will experience pins and needles, numbness or a burning pain, as well as a more dull and nagging pain in the leg. Typically, sciatica goes hand in glove with issues relating to the lower back discs. Strain or prolapse or bulging of those discs onto the little nerve roots that exit the spine to form the sciatic nerve. Let's talk a little bit about that anatomy. Here is an example of the human spine. This is the back, this is the front, and we can see that it has these nice curvy shapes. That's so that it can behave like a coiled spring, a bit of shock absorption. We can see the bones, these white blocks on this model that stack up on top of each other, 24 of them, and in between those are the discs. These are little cartilage spacers that also act as shock absorbers in between the bones, but as I say, act as spacers to make space available to these little nerve roots, these pairs of nerve roots that come out on either side of the spine. These are the first branches off the spinal cord, and it's the lower two nerve roots that exit the lumbar spine, and three more down in your pelvis that club together and form the sciatic nerve that passes down underneath the muscles of the buttock into your leg. So if you're involved in a job that involves lots of sitting down, that can tilt your pelvis, flatten this curve and increase the pressure on those discs. If you do a job that involves lots of bending over, bending forwards, lifting, pushing, pulling, carrying, that again can do the same thing to your lower back. Interestingly, if you have a repetitive activity that means that you're looking down a lot, that can round the upper body and again mean that you're decreasing this hollow shape in the lower back, increasing the pressure on the discs and making you vulnerable to a disc injury and potentially sciatica. The other thing that will irritate the sciatic nerve from a sports and exercise point of view are lots of repetitive activities going into flexion, forward bending. Sit-ups, for example, will take your spine into that forward bent position and back down. Up into the sit-up and back down. For some people, that can be a very, very bad idea. There are much safer ways of exercising your abdominal muscles, and we have other videos which will demonstrate those, and I should take a look at those if I were you. So sciatica is irritation or pinching of those nerve roots or the nerve itself as it passes down through the buttock into the leg. The cause of your leg pain, potentially sciatica, needs to be properly assessed so that we can identify the tissues that are involved in the injury and apply an appropriate treatment. What we as chiropractors do is to ask you lots of questions about the history of your complaint, about your medical history in general, and then examine you thoroughly. We will test your muscles, your joints and your nerves for their function. Sometimes x-rays are useful as a diagnostic tool. We in the clinic here in Winchester have a state-of-the-art digital x-ray system, so we can get almost immediate pictures of your bones, and we can make a judgment about what might be causing your complaint. We can then sit down and discuss what's wrong, why it's wrong, and what we might be able to do to fix it, and you can determine whether or not a course of chiropractic treatment is something that you're prepared to go for. The vast majority of patients that we see who present with symptoms of sciatica do very well with the right course of treatment. As a special thank you for watching this video, I'd like to make you an offer. If you're a local resident, we would like to offer you the opportunity to come into the clinic here in Winchester to avail yourself of that consultation. So we will discuss what's wrong, we will examine you, we will take x-rays if necessary, and we will report back to you on what we find, why we think it's wrong, and what we can do to help you. Typically, that appointment would cost you £114. As a special thank you for watching this video, and if you use the offer code GS3, we will offer that to you for £20. It's a bargain. We only have a small number of these to give away every month, these consultations to give away. So give us a call, use the code, offer code GS3, speak to one of my receptionists, Judith, Janet or Fiona, on 01962 843 242. That's Winchester, 01962 843 242, offer code GS3. Come and talk to us about your sciatica.